So this came up in the chat, and it was actually a question that we had prior to getting on the phone. And since we're talking about this, I guess we can address the elephant in the room. What is the 5mm rule? Where did it come from? And what are your thoughts about it?
Yeah, well, I don't like the 5mm rule. It's a gross oversimplification of a relatively complicated pathoanatomical concept. But the more we try to remove it and replace it with something else, we're left with the fact that it's very difficult to replace because nobody has come up with a usable replacement that we can all talk to each other about. So the beauty of the 5mm rule is I can call you in New York and say I just saw somebody with 8mm of tonsils below the foramen magnum, and you kind of have a picture of what that looks like. So it's really easy to measure, it's easy to communicate, and it does set some sort of a minimum standard for how we're diagnosing Chiari. So all of the numbers I just gave you, like the incidence and prevalence and everything, that all has to do with what we are calling Chiari in this country, which is the 5mm rule. That's where all those numbers come from. There are a number of huge problems with the 5mm rule. So it came out of a paper in 1984. Barkovich at San Francisco was the first author. He's a radiologist. And this is the dawn of the MRI era. So the first MRI scans were done in the late 70s, and then they became a little more popular in the early 80s. They still weren't commonly being done then, but they were at least getting done sometimes. So at that time, physicians started to see Chiari on MRI. And before that, they thought it was this incredibly rare thing that they would probably never see in their entire careers. Like it was in the pathology books, but there was no warning to any of these radiologists that now that we're doing MRI scans, we're going to start seeing a lot of Chiari. So Barkovich was, I think, very well-meaning. He decided to try to set a standard for Chiari, because before that there was literally no standard. You would just call it Chiari if the tonsil seemed low to you in some kind of subjective sense. So he did something very simple. He took 25 Chiari patients from San Francisco, and he measured all of their tonsils. And then he took 200 people who he pre-selected as being normal, that is, or not having Chiari. And then he just compared the groups, and he asked the simple question like, what if I set the number at 10mm? What would happen? Would I diagnose all the Chiaris or not? Or would I diagnose some normal people with Chiari? Okay, well, what if I set the number at 8mm or 5mm or 3mm or 0? And using a series of sort of trial cut points, he came up with the notion that at 5mm, all of the Chiari patients would fall into the Chiari group, and none of the normal people would have a Chiari. So he thought this was a really clean cut point and basically published on that. You introduced the concept of prevalence and incidence earlier. So another sort of useful public health term is positive predictive value, negative predictive value, and then specificity of terms versus sensitivity. So Barkovich claimed that with 5mm, he was 100% sensitive and specific. But that's nonsense. He made it, he did the best he could in 1984. It was a really nice paper in 1984, but it is absolutely not 100% sensitive or specific. And why would he say it was when it wasn't? Well, because he was studying 25 patients. So it was true in that tiny little group that he was studying, but now we can study 20,000 patients, and we know a lot more in 2020 than he did in 1984. So what have we learned, in the extra few decades that we've had to study the problem? Well, we've learned that a lot of asymptomatic people have 5mm of tonsils below their foramen magnum. Barkovich said that was not possible. It's absolutely not true. Thousands and thousands of Americans are walking around with tonsils below their foramen magnum and have no symptoms. So it fails on that point. It fails also on the point of the idea that there's nothing that says that 4 millimeter of tonsils is normal and 5 millimeters is terribly diseased. And therefore, if you have a tight foramen magnum and limited CSF flow and classic Chiari symptoms, that you somehow don't have a Chiari malformation just because we can't measure you at 5 millimeters. Well, that's nonsense too. Obviously, you have a Chiari malformation, you just don't have tonsils that low. If we can see that you're pathophysiologically the same, like you have impacted tonsils, everything is squished back there, that's a Chiari. So then Jerry Oakes recognized that a couple of decades ago and came up with the concept of Chiari Zero, where he said that, again, pathophysiologically, same thing. Everything's crowded back there. You got classic Chiari symptoms. You have a cervical syrinx, a big cervical syrinx, and that's a Chiari malformation. But because we don't have 5 millimeters, we're going to call it a Chiari Zero. So I think that was a useful concept. So the 5 millimeter rule fails at both ends of the spectrum. It fails in labeling a bunch of people who feel perfectly healthy and normal as having a brain malformation. And it fails on the other end of the spectrum as telling people who have real symptoms of Chiari malformation that they actually don't have a Chiari malformation. So there are huge problems with it. Lots of groups have tried to replace it, and nobody has done it successfully, in my estimation. We've done it. We've tried to come up with, we studied 100 different ways of measuring the posterior fossa, the back part of the skull, the brain, the space around the brain, CSF flow, and we made we got excited at first because we found a few things that seemed to be important, like posterior fossa volume and clival length. And we thought, oh my gosh, this is the holy grail of Chiari. Now we can identify and predict who has symptoms and who doesn't have symptoms. Then we took that information and we applied it to a new group of people, not the group that we studied in the first place, but just a completely new group of 100 people. And we said, does this simple, formula predict who's going to have symptoms or not? And the answer is no. It was completely useless. And other groups have done the exact same thing with similar results. There have been a few papers written where people have done the first part of that experiment without the second validation part of the experiment. And they've we solved it. Now we know that there's 3 other anatomical features you can study, and that's going to predict who has symptomatic Chiari. So now we have a replacement for 5 millimeter rule. And I wish those papers were not published because they're just confusing. Again, if you take that information and look at a validation group, it never has worked so far. Maybe somebody will find the answer someday. There's a lot of people still trying, but nobody's found it to their satisfaction yet.